Your information station. WTIM.
Welcome to the WTIM Morning Show. I'm Avery Cooper. Your stream brought to you by Landmark of Taylorville, where you always do better with Landmark and People's Bank and Trust, where they put people first. I have Southern Illinois University Medicine Dr. Amanda Cruz Johnson here on the phone. Great to have you here, Doctor.
Hi.
So tell me a little bit about some of your background. What is it that you specialize in and how you got there?
So I am a doctor of family medicine, or board certified in family medicine. I started out as a Southern Missouri girl, actually, and did all my college and medical school in Northeastern Missouri at Truman State, and then at A.T. Still University in Kirksville, Missouri. And then came and did my residency in family medicine in Springfield at SIU, and just fell in love with Southern Illinois. It felt so much like home for me. And so now I work both in Springfield and in Taylorville doing family medicine. So your primary care, kind of one-stop shop for a little bit of everything.
Could you dive in a little bit more into what family medicine is? Obviously, it's in the name. It's medicine for families, but, how does it differ from other providers?
So family medicine is a very broad type of medicine. It's considered primary care, so your first stop before you go and see specialists. You come and see us for health maintenance things like your screening, colonoscopies, ordering mammograms, doing cervical cancer screenings. We can do all of that either in our office or get you set up with the right people to have those procedures done. So we're like the first line of medicine, the people you come to see with your sniffs and coughs, or the people you come to regularly to just make sure that you're the healthiest version of you that you can be.
Sounds like you just listed off some of the services that you're able to offer. What other services do you offer? Or does that cover it?
Well, out in Taylorville, I am very fortunate to be able to offer a lot of women's health care. That includes prenatal care as well as doing deliveries at Springfield Memorial Hospital. So if you are expecting and are considered a low-risk pregnancy, that is that you don't have, diabetes requiring insulin or other high-risk factors, you can come and see me in Taylorville, so close to home, get your prenatal care, and then ultimately when it comes time to deliver, I'll be there with you in Springfield doing the delivery.
About how often are you in Taylorville?
I personally am in Taylorville once a week on Tuesdays, but one of my colleagues will be at the Center for Family Medicine there in Taylorville, 5 days a week.
Like cycles, I understand.
Yes.
Right. You do one day, another physician or provider rather will do another day, and so on.
Right. But we're all really well connected. So if there's ever anything one of my colleagues needs, they can easily reach out to me or I can reach out to them. So quality care 5 days a week, regardless of which provider you're seeing.
I'd imagine you're accepting new patients. And
Oh, we are.
Yeah. Go tell me a little bit about that.
So we are happy to see new patients, and we like to say in family medicine that we see cradle to grave. So you can bring us your newborns, your kindergarten-aged babies, your teenagers, all the way up through, our geriatric nursing home patients we see there. So we offer a little bit of everything, and we'll do our best to give everyone's family the best care.
Anything else that you'd like to say about your availability in Taylorville or in Central Illinois, or just the services that you offer?
Well, in addition to providing prenatal care, which I'm very passionate about, so I would love to have more women seeking out care for their cancer screenings and just overall well-being. I would love to see them and get to know them. Because I know, having just had a baby myself, how important it is to have a good relationship with your OB provider. I would love to be that for any women who need it in Taylorville or the surrounding region. one of the other cool things that I do is called osteopathic manipulative therapy. And my medical degree is one of osteopathy. So I'm a DO versus MD, which is seen more often. It's an equivalent medical degree, but I can do hands-on therapy to help with things like back pain. I can help with abdominal pain if you've got a lot of swelling or edema. I have hands-on therapies I can do in our office in Taylorville to kind of help with those things. So I'm kind of a 1-2 punch of specialized women's health care as well as hands-on therapy for whatever ails you.
Well, you have a lot of interest in women's healthcare, but could you say the name of that other certification you have?
Of course. I'm a DO and I perform osteopathic manipulative therapy, or OMT.
Osteopathic manipulative therapy. Did I get that right?
I believe so, yes.
Okay. So it sounds like that really focuses on the bones and keeping the muscles around the bones too just healthy and without pain. Do I have that right?
Well, as an osteopathic physician, we believe in whole person healthcare, that, every structure and function is interconnected. So in helping kind of reset a body back to neutral, we feel the body is able to better heal itself. So it's not just bones and muscles, but it's the bones and muscles and how they affect things like your breathing and your digestion. And so, yes, I will happily see someone for back pain or hip pain, but I can also help with things like constipation or some hands-on techniques to help when you've got a congested nose, because by getting our bodies back to that factory reset, we hope to be able to get you feeling better that much faster with less medicine.
I don't want you to give away too many secrets without people going to see you, but what would you say is a really cool thing that you show people that they can do at home when they come and see you?
Oh, I have been showing a lot of what's called facial effleurage, which is a hands-on technique where you rub areas of the face to kind of help promote drainage. So a lot of those fall allergies are kicking up. So adding that into your routine can really help get those fluids mobilized and have you feeling less like your head's a balloon.
I've seen marble rollers for your face. Is that in the same neighborhood of practice?
Definitely.
Yeah.
They have their place. They can really help mobilize that fluid, and they look pretty doing it. So
yes, they do. Yeah, they do. My partner, she has those all, and I'm seeing her roll in her face, and I think to myself, is that really helping? Is it helping?
It definitely can. Now, am I going to say that rolling marble is going to brighten your skin? That one I'm less sure of. But when it comes to mobilizing the lymph in your face to help with circulation, I'm all for that.
How much of your practice has to do with maintaining good core strength?
That is an excellent question. As far as maintaining good core strength, it's not something I talk about on a regular basis, but I do like to discuss with my patients the importance of healthy diet and lifestyle. And that includes exercises, whether it's just getting up and being mobile or doing those more intensive exercises, depending on their starting point. So it is important to maintain health all throughout, whether it's just morning walks, or if it is, hey, add in these core strengthening exercises.
And that goes back to the original point that you made about how everything in that profession is interconnected, right? It's with your bones, your muscles, they are all connected and they all impact each other. And externally too, your diet will also impact those things. Just summarizing, if I have that right.
You do. And we also add in the very important component of mind and spirit. So we also at the Center for Family Medicine address mental concerns, whether you've got anxiety, depression. We have some wonderful psychiatrists who work with us because we really do try and practice that body, mind, spirit connection, because when everything's working in harmony, you're going to feel healthy you're going to be able to live healthier and do the things that you want to do. And as an osteopath, that's really important to me.
One more time, where do you practice?
I practice at the Center for Family Medicine on 303 East Bidwell in Taylorville, as well as at the Center for Family Medicine in Springfield on 4th and Carpenter.
All right, let me reintroduce you. That's Dr. Amanda Cruz Johnson. She's here to talk about where you can see her in her osteopathic remedies and all the other family medicine care that she has to offer as part of the Southern Illinois University Family Medicine Clinic and all the other places you can go see her, including in Springfield. Your stream brought to you by People's Bank and Trust, where they put people first, and Landmark of Taylorville, where you always do better with Landmark.
WTIM.
Taylorville Care Center, Taylorville's premier nursing facility, is hiring, and they're offering the best opportunities in town with new wages, elite pay, and premium pay programs for RNs, LPNs, and CNAs. Nurses may be eligible for major medical insurance if qualified as a level 2 nurse. Their exclusive work perks has something for all employees. Quarterly retention bonuses and weekly vaccination incentives are also offered. Apply to learn more. Join the Taylorville Care Center family by finding their ad on Indeed.com. Taylorville Care Center, caring for the community for nearly 50 years.
Big Bad Night, Appliance World. When you buy from us, you get the whole store.
What do you mean, I get the whole store?
I'm Dennis Regan, chairman of Dick Van Dyke Appliance World. And when we promise you the whole store, we mean all we do is appliances. We offer a showroom full of the top appliance brands, complete with our free 10-year protection plan.
Who does your warranty work? Some outfit with a 1-800 number?
No way. Our service and installation technicians are employed and factory trained by us. And our protection plan means you pay nothing for covered repairs.
So, I get a free 10-year protection plan, a guaranteed best deal, a hometown service department, and a showroom full of name brand appliances? Wow!
Hey, lady, that's my line. All we do is appliances, and we do them better than anyone else. Wow!
Big Bad Night, Appliance World. When you buy from us, you get the whole store.
And yet another major brand just announced it's halting all social media advertising.
The two most overused and abused words in advertising are truth and trust. They are the two most precious commodities for all brands, big and small. As an advertiser, you have to trust your partners to protect your brand's truth using the media consumers trust. Radio, it's on.
Trust the Miller Media Group to deliver your message.
Let's swing open the farm gate together every day on News Talk WTIM. I'm Stu Ellis, your host of the long-running agriculture feature called The Farm Gate. I bring the latest news and information on where agriculture is and where it's going to WTIM Ag listeners every weekday morning. From tariffs to treaties, from the Board of Trade to the running board of your truck, I cover Central Illinois agriculture every weekday on the Farm Gate. Hear it on all of News Talk WTIM's many platforms, on air or online. Join me, Stu Ellis, for the Farm Gate.
C&B Bank and Trust is helping to open doors for your wealth. Schedule your appointment with Victor Henson by clicking their icon at TaylorvilleDailyNews.com. Not FDIC insured, no bank guarantee, may lose value.
Hi, I'm Bob Raddings of the Bob Raddings family of dealerships. See our huge inventory of about 2,000 vehicles by clicking on our ad at TaylorvilleDailyNews.com.
Your information station, WTIM.
Welcome back to the WTIM Morning Show. I'm Avery Cooper. Your stream brought to you by Landmark of Taylorville, where you always do better with Landmark and People's Bank and Trust, where they put people first. Find those streams online on the TaylorvilleDailyNews.com Facebook or on YouTube at WTIM TV. I'm here on the phone with Dr. Amanda Cruz Johnson. She's part of the Southern Illinois University Family Medicine, and she also practices in osteopathic medicine. And she also is very involved, doctor, with women's health and women's health care and keeping up with women's health. So, doctor, before we get into that, just provide a brief overview of where and when people can go and see you.
So I am located at the Center for Family Medicine at 303 East Bidwell in Taylorville. And I'm there on Tuesdays all day. And one of my colleagues is there 5 days a week. So there's someone there to see you any day of the week. And I also am located up at Springfield at the Center for Family Medicine on 4th and Carpenter.
Well, obviously you have a very big passion for women's health care. And so I wanted to give you a chance to talk a little bit about that. What would you say is a good time period in rather length interval, right? For how long someone should, this is a poorly worded question. How often should somebody go and get checked out as a woman for cancer and other stuff like that?
It's a very good question. So we recommend, just as a rule of thumb, touching base with your doctor, your primary care doctor, like we are in family medicine, at least once a year, whether you're healthy, ill, any of those things, just to make sure everything is going well, that you're up to date on vaccines as well as preventative screenings like cervical cancer screening. Cervical cancer screening starts at age 21, and you will be screened once a year for the first 3 years. And after that, if everything looks good, there are no abnormalities on your screenings, it spaces out to every 3 years, and then after age 30 to every 5 years. So a lot less screening than there has been in the past. Mammograms, we start recommending around age 40, every year, every other year, up until age 65. Now, if you've got a strong family history of breast, ovarian, endometrial, those sort of cancers, the screening guidelines do kind of change, and we might start screening you a little early. This is why it's so important to go and talk to your doctor, build a good relationship with them so that they know you, they know your family history, and can really make sure that you're getting the screening that's most appropriate for you.
And I understand too, just because someone or a doctor may find an abnormality, that doesn't necessarily mean it's cancer, hence why it's so important to go get checked.
100%, yes. Every test has its limitations, but it's so important that we catch things early on. And your doctor is more than happy to discuss results with you and help explain them. It's our job to make sure you understand your health care because we're there to help you, not tell you what to do.
Anything else that you'd like to say about women's health care?
Like I said before, I do offer prenatal care, and that can be from the first time you find out you're pregnant through delivery and after that, because I also take care of babies. And if you're not wanting pregnancy, that's something I can help with too. I'm well versed on birth control. I have a spiel and handouts I love to show people because I think it's really important to have control over when you are ready to have a baby. It's a huge commitment. I haven't slept through the night in over a year because of my pregnancy and my newborn. So I understand how big of a time commitment, a love commitment it is to have a baby. And I want to help women, whether they want to have that right now, or if they want to maybe save it for down the line a few years.
I think you just provided me a little bit of birth control because I really like my sleep.
Sleep is very great.
No, I know that also there's a lot of different clinics going on right now. Provide the details if you would, doctor.
Of course. So at our Taylorville office, we have an injection clinic that happens. So if you're somebody who needs long-term medication or long-lasting medication that's prescribed by your doctor, we can help make sure that you get that injection on time. That includes birth control shots. That includes long-acting antipsychotic medications. We're going to start offering flu shots here very, very soon. And it's incredibly important to get your flu shot to help protect yourself and the community around you. We are working on the new COVID vaccine, so stay tuned for more information on that. But we like to stress the importance of preventative health in primary care as family medicine physicians. So that includes getting those routine vaccinations, whether they're the shingles shot when you're age 55 or those kindergarten shots before your little ones start school. So we offer all of those.
Doctor, thank you so much for your time.
Thank you.
That's Dr. Amanda Cruz Johnston. She practiced family medicine with the Southern Illinois University Family Medicine Clinic here in Taylorville.
WTIM.
With SRN News, I'm Rich Thomason in Washington. There is a